So, 4 months after the novel coronavirus was first detected in this country, finally widespread testing is available, or certainly becoming available in many areas. But getting one is still a challenge for some people. And now doctors in a group in Philadelphia are taking matters into their own hands. Well, they have been for a while. Dr. Ayla Stanford joins us now to talk a little bit more about your efforts. Doctor, you've been actually doing this for a while now because you saw very early on that there was a problem getting people in the African American community in Philadelphia, which is a large community, getting them tested. And so you went to them. Give us sort
That's
of the
correct.
brief version of how that all happened.
Yes. April 3rd, a report came out that African Americans were disproportionately affected by disease and dying. I reached out to the city and said, how can I help with the efforts? There were no resources being allocated to those communities. And so with a group of doctor friends, we got our supplies together and we went to the streets to the people to offer up the tests without the barriers that were typically seen with what was offered from the city and many academic institutions in our city.
So, doctor, over the course of this pandemic, we've seen a lot of misinformation about the impacts on minority communities spreading online. How are you working to make sure people are getting the right facts?
Right. Well, prior to us actually going to the streets and going to church parking lots and testing people, we had a large social media campaign where we were having live conversations with the younger generation where they talked about 5G and they talked about Dr. Sebi and they talked about home remedies and they talked about all the misinformation and gave them a forum to discuss it so we could dispel it. We used it in the community as opposed to a top-down approach to really disseminate the information. And I believe that is resonating now.
So I just want to give everyone a little bit of full disclosure in that everyone knows that I live in Philadelphia. And several weeks ago, my husband, along with a few other people, held a bit of an Instagram fundraiser to help out groups just like yours. And they were having a meeting with you. And I sort of forced my way in with my house robe and on and everything, a Zoom meeting. And I got to ask you a few other questions. Doctor,
Right.
I thought it was a little interesting that, you know, you being sort of the first person to do something like this, I think it's given you some particular insight into the disease in the African American community, but also healthcare. I mean, I feel like you're gathering information that healthcare institutions and insurance companies haven't really bothered to gather before.
Right. That's absolutely correct. And they could glean a lot from what we are seeing because folks, some places we've gone, everyone has had health insurance and they still couldn't get a test. So that just lets you know that access is really an issue, and the only common denominator is the color of your skin. And so people were going places, and if they weren't old enough, they couldn't get tested. If they were on foot and it was a drive up, they couldn't get tested. If they weren't a healthcare worker, they could not get tested. If they didn't have an appointment and the hours were very brief, they were from 12 to 4, and you had to show up at a certain time, you couldn't get a test. A lot of the city and academic places, you show up and you see more police than you see people actually getting tested. You see barricades for people to be lined up and sort of shuttled in. Our approach, it's very personalized. We help people fill out the paperwork if they need it. We take the time to alleviate the fears they may have and dispel the myths about the testing. And we're there because we care, not because someone forced us to be there. And that is really showing when the city has a testing site literally 2 blocks away and there's no one there, but everyone is with us. And that's, I believe, is because of the trust that we have garnered amongst the people in the communities.
Doctor, one of the points that I want you to sort of hit on a little bit more is something that Anne-Marie mentioned in her question, which is the healthcare system in this country. A lot of people will look across the world as coronavirus, COVID-19, has continue to grow in populations where they don't have large African American or African communities. And this idea that's starting to take root in a lot of people's minds is, well, I don't have to worry about COVID-19 because I'm not in the demographic of people that have been affected or infected by the coronavirus. And I want you to talk a little bit about that. As we've seen people in France or in Germany or in South Korea or in China battling this pandemic, it's not this virus is not targeting or is not more susceptible to African Americans simply because they are Black. There are a lot of issues at play. There's a lot of nuance here that I want you to sort of shed some light on for people who may not understand that.
Absolutely. So the fact that, oh, I'm not Black, I'm not poor, I don't live in an inner city, so this isn't going to affect me, or I'm not elderly, I don't live in a nursing home, unless you live in a room and you never associate with the public, it will affect you, because many African Americans are the face front employees that keep the country running right now. And so you will interact at some point with someone. For example, in terms of there was initially a thought that because we were disproportionately have certain conditions that we have poorer outcomes with. But it's not about that necessarily. Certainly, if you're not in the greatest shape of health, when any disease hits you, you may not fare as well. But it hasn't even been that. It's if you show up at the ER and you can't come in because you don't have a referral from a doctor, but you meet all the criteria, that's an access issue. Correct. And so those are some of the issues that we are trying to break down barriers about. And again, the economy, if you remove a large sect of the population who contributes to the economy and the wealth of the country, because they're ill, that affects everyone. Right? And so there are many ways that not having a certain sect or population in the community affects you, whether you believe it or not.
Very important information, Dr. Stanford. Thank you very much for joining us. We appreciate it.
Thank you for having me.